In Unit 14A.IV, we'll be discussing mood disorders. The first mood disorder that we'll discuss is bipolar disorder. Some of the key facts is that bipolar disorder used to be called manic depressive disorder. Why? Because there are two emotional extremes that people with this disorder experience. There's mania, which is the manic stage, and then there's extreme depression, which is the depressive stage. And this affects only about 1 to 2% of the population, which turns out to be thousands of people. It's equal in males and females, and it peaks in vulnerability at ages 20 to 29. So what is mania? What is the manic stage of bipolar disorder? It's an extreme sense of euphoria where you feel really, really great. You have really high self-esteem. You feel euphoric. You have high energy. You're not very sleepy. You have extravagant plans. You're very optimistic and ambitious, hyperactive. You have rapid talking. But this can also leads to impaired judgment, impulsivity, excessive gambling, excessive spending, sexual recklessness, and excessive drug and alcohol abuse. It's extreme arousal on all levels. Well, because you burn all that energy, all the glucose and calories and neurotransmitters during the manic stage, the next stage will then be depression. All right? This is the inability to think clearly. You may experience suicidal thoughts. You will experience excessive sleep. Why? Because you missed out on all the other sleep during the manic stage, so you need to experience a REM rebound. You'll feel lethargic, and you'll have social withdrawals, which is characteristic of depression. Some interesting side notes about bipolar disorder. The majority of those suffering from bipolar disorder at some level enjoy their periods of mania. And why wouldn't they? They have high self-esteem, they feel euphoric, they have high energy, and these traits are seen as attractive. The surges of productivity and creativity are oftentimes encouraged, especially in Western cultures. The causes of bipolar disorder. While we're still learning about it, most of the causes are predominantly genetic, neurochemical, so neurotransmitters, cognitive, and interpersonal, so the self-fulfilling prophecy here. There's strong evidence for genetic causes of bipolar disorder. There is a huge difference between the concordance rates between identical and fraternal twins. Identical twins, if one identical twin has bipolar disorder, it's much, much likely that the other one as well. If a fraternal twin has bipolar disorder, the other will probably not. So there may be some predisposition here with environmental factors precipitating the symptoms. Again, it's not nature versus nurture, guys. It's nature and nurture. So the neurochemical explanation is that abnormal levels of norepinephrine and serotonin. So they might be really, really low or really, really high levels. If you have really, really high levels of norepinephrine and serotonin, you're going to be in the manic episode. If you have low levels of serotonin and norepinephrine, you're going to be in the depressive episode. This is the explanation for the change in energy and self-esteem and emotion. This may be hereditary. Drug therapy, though, is very effective for this. The cognitive approach and explanation is negative thinking. Negative thinking leads to depression. Or is it the other way around? Depression may be caused by learned helplessness, passively giving up on certain goals and objectives. How do people handle setbacks? Do you take things personally? If so, you might fall victim to bipolar disorder. Pessimistic people have increased depression. Rumination is an increase of depression, male and female. It affects them both equally. Interpersonal is where no one wants to hang out with me. It's the Debbie Downer or negative Nancy effect. So they may have a lack of social support, or they may gravitate towards other negative people. Misery loves company. Have you ever heard that saying? And then another mood disorder is the major depressive disorder. Major depressive disorder is an intense depressed mood that's which reduced interest or pleasure in activities and loss of energy for a minimum of 2 weeks. However, major depressive disorder may last it could last for months, if not years, depending on the situation. There's also seasonal affective disorder, where your mood changes with the seasons. Typically, your mood becomes more depressed during the winter months and more uplifting during the summer months. UV lamps are used as treatments for depressive disorders, and we'll talk about why later.